And our final witness is Ms. Taylor St. Germain. Ms. St. Germain is the Deputy Director of Reproductive Equity Now. She joined the organization in February of 2022 as the Communications Director and has since helped pass Massachusetts post-Dobbs Shield Law, the Commonwealth's latest maternal health package, and helped guide the organization's expansion into New Hampshire and Connecticut. So she has been giving leadership in New England on these issues with her organization. I know her well. She was my press secretary on my staff, and so she was a great loss to me on my staff, but an incredible advance for the cause of reproductive equity in New England and across our country. So we welcome you. Whenever you feel comfortable, please begin.
Thank you, Senator Markey. Good evening, or good afternoon. It's not evening yet. I would like to start today by thanking Senator...
Is the microphone on?
Oh, is it? Can you hear me now?
Okay, beautiful.
Okay. By thanking Senator Markey and Representative Fletcher for convening today's critical and timely spotlight hearing, and to the members here with us today for strategizing with us on how we can protect access to care. I'm honored to be here alongside my fellow witnesses and partners in this fight. And lastly, I'd like to extend a special gratitude to the National Women's Law Center for authoring the eye-opening report that inspired today's hearing. My name is Taylor St. Germain, and I'm the Deputy Director of Reproductive Equity Now, a New England-based organization working across Massachusetts, Connecticut, and New Hampshire to make equitable access to the full spectrum of reproductive health care a reality for all people. Much of our work does center around defending abortion access, which we know remains relentlessly under attack. But as you've heard from other witnesses today, Trump and his anti-abortion friends are not satisfied with only stripping away access to abortion care. They are coming for contraception, too. Access to contraception is a fundamental part of reproductive health care and a critical tool for ensuring that people can decide if, when, and how to start or grow their families. We've already heard a lot from my fellow panelists about attacks that we are seeing across the country. I want to share a little bit about our experience working in New England, a region of primarily protected states, where we're grateful that an overwhelming majority of our leaders support access to contraception and reproductive health care. But even here, we still feel the impacts of these national attacks. And more than that, we do feel a responsibility to push back and meet these threats head on with state-level policies to ensure that care is available, affordable, and accessible to everyone who needs it. When Donald Trump first threatened the Affordable Care Act's contraceptive mandate in 2017, Massachusetts stepped up, passing the Contraceptive Access Law, which required state-regulated health plans to cover contraception at no cost to the consumer. This law also guaranteed patients could get up to a year's supply of birth control at once. I want to note Connecticut and New Hampshire have passed similar laws. This has been a lifeline for students, for low-income and rural communities, or anyone who needs reliable, affordable, and uninterrupted care. Massachusetts didn't stop there. In 2022, the Department of Public Health issued a statewide standing order for emergency contraception, clarifying that people may use their insurance to cover medications like Plan B or Ella at the pharmacy counter, no prescription required. Early results show that this has had a big impact. We have seen emergency contraception fills increase by over 30% in the first year alone. And since the Dobbs decision, as our clinics across our region have seen a significant increase in patient volume, placing growing pressure on already stretched systems. States like Massachusetts and Connecticut have responded by authorizing pharmacists to prescribe and dispense birth control directly to patients with no doctor's visit required. This simple change removes major barriers to care, especially for people who can't afford to take time off of work, face delays in getting an appointment, or may struggle to find a provider at all. We also know that protecting young people's confidentiality is critical. If teens fear their privacy won't be respected, they may skip care altogether, putting their health, their education, and their futures at risk. This past legislative session, we did see anti-repro policymakers in New Hampshire attempt to end confidential reproductive health care for minors. But we know that contraception access is popular, and when faced with lots of community outrage, lawmakers were forced to drop this provision from the bill. Conversely, in Connecticut, where the right wasn't yet written into law, legislators acted proactively this year to make sure teens can access birth control and pregnancy-related care without being forced to disclose to a parent or a guardian. And yet, Even with these safeguards in place, due to the attacks coming out of the Trump administration, there will be people in New England who will be unable to access birth control, providers' hands who will be tied, and funding gaps too deep and too wide for states to fill. We have to be realistic. State leadership alone cannot undo the damage that the Trump administration is causing. And with cuts to Medicaid, provisions to restrict funding to Planned Parenthood, and attacks on abortion providers, this latest reconciliation law is a backdoor ban on reproductive health care. It undercuts state protections and overrides states' ability to safeguard our rights. And the result is that patients and providers are stuck between a confusing patchwork of laws, with states trying to protect care in some cases and federal policies trying to block it. States with strong leadership will continue to step up with bold ideas and practical solutions, but they can't do it alone. When it came to Roe, we did wait too long to take decisive federal action to protect abortion care, and that delay cost us dearly. We cannot make the same mistake again when it comes to contraception. I'm here today to tell you that it is absolutely critical that Congress take action to pass the Right to Contraception Act. We have to use every available tool in our toolbox to protect and expand access to this essential, life-saving care before it's too late again. With that, I'd like to thank you all again for hosting today's Spotlight hearing, and I look forward to answering questions.
Beautiful. Thank you so much.